This is going to be Critical Care Pharmacology, Part 12, Diuretics. First one we're going to talk about here is Furosemide or Lasix. It's a loop diuretic, electrolyte, and water balancing agent. Blocks sodium reabsorption in the renal tubules, and this does this in the loop of Henle, and achieves a diuresis effect. So if we water follow sodium, and if we send sodium out, then water is going to follow it. Very simply. This is potassium depleting. Whenever this does this, this action occurs in the loop of Henle. We're going to actually send sodium out, and whenever it gets reuptake, the water will just continue to follow into the tubule. So all of the capillaries, as it's floating by, water will continually flow out into this, and this will make more urine. Indication: congestive heart failure or fluid volume overload, mild renal function impairment. This will excite renal function and make the kidneys work better. Contraindication: any kind of known hypersensitivity, anuria or I make no urine, hypotension, or dehydration. Side effects: cramping, diarrhea, nausea or vomiting. You can get tinnitus off of this as well, vertigo and headache, leukopenia, anemia, urticaria, rash, hypokalemia from not really watching our potassium levels, and then dehydration. Dose: 1 mg per kilogram IV over 1 to 2 minutes. Special considerations: monitor serum electrolytes. Bumex or Bumetanide is another one of our diuretics. Class on this is going to be a loop diuretic as well, electrolyte and water balance agent. Blocks sodium reabsorption in the renal tubules, achieves diaphoresis results, exhibits diuresis 40 times greater than furosemide, shows shorter half-life, which is a little bit better. The half-life on it decreases, and that way we can just get an initial fluid movement and then kind of get past that and not get so much of a long-term effect. Indications on this: congestive heart failure, fluid overload, mild renal function impairment. Contraindications: known hypersensitivity, anuria or I make no urine, hypotension, and dehydration. Side effects: cramping, diarrhea, nausea, vomiting, tinnitus, vertigo, headache, leukopenia, anemia, urticaria, rash, hypokalemia, and dehydration. Pretty much the same effects as Lasix. Dose on this: adult 0.5 to 2 milligrams IV over 1 to 2 minutes. Repeat in 4 to 5 hours. Maximum dose daily is going to be 10 milligrams. In the pediatric patient, 0.015 to 0.1 milligrams per kilogram every 6 to 24 hours. Maximum dose 10 milligrams daily. Special consideration: we need to monitor the patient's serum electrolytes. Both of these are potassium depleting, and we can easily make somebody hypokalemic. This ends Part 12. Got any questions, feel free to contact me. Roy Smith at redlandscc.edu or smithr@emsa.net. Thanks.